Welcome to Optometrist BD. Today we will discuss squint and its types in detail. At the beginning of the discussion, we will learn what squint is. Squint is a condition in which both eyes do not look at the same place at the same time. It usually occurs in people who have poor eye muscle control or are very far-sighted. Types of squint. There are three primary types of squint. 1. Apparent squint. 2. Heterophoria, or latent squint. 3. Heterotropia, or manifest squint. Apparent squint. An apparent squint, also known as pseudostrabismus or pseudo-squint. It is a false appearance that one or both eyes are misaligned. Actually, the eyes are perfectly straight, and alignment is normal. Causes of apparent squint. Number 1. Prominent epicanthic fold in infants. In this condition, a false appearance of convergent squint is seen. Number 2. Hypertelorism. Hypertelorism is a condition characterized by an abnormally increased distance between the eyes, caused by a wider than normal separation of the orbits. In this condition, a false appearance of divergent squint is seen. Number 3. Hypermetropia, an apparent divergent squint due to large angle cup par. Number 4. Myopia, an apparent convergent squint due to a smaller, or even negative angle cup par. Heterophoria or latent squint. This is a tendency for the eyes to deviate, but that is prevented by the fusion mechanism for the interest of binocular single vision, BSV. But, under conditions of stress, or when the fusion is interrupted, the deviation readily becomes manifest. Types of heterophoria. 1. Aesophoria. 2. Exophoria. 3. Hyperphoria. 4. Cyclophoria. Aesophoria tends to deviate inward. Pay attention to the images below. 1. Both eyes are normal position when both eyes are open. 2. Right eye deviates inward under cover. 3. Right eye corrects deviation when cover is removed. Exophoria tends to deviate outward. Pay attention to the images below. 1. Both eyes are normal position when both eyes are open. 2. Right eye deviates outward under cover. 3. Right eye corrects deviation when cover is removed. Hyperphoria tends to deviate upward. Pay attention to the images below. 1. Both eyes are normal position when both eyes are open. 2. Right eye deviates upward under cover. 3. Right eye corrects deviation when cover is removed. Cyclophoria tends to deviate torsionally. Pay attention to the images below. 1. Both eyes are normal position when both eyes are open. 2. Right eye deviates torsionally under cover. 3. Right eye corrects deviation when cover is removed. Heterotropia is a true misalignment of the visual axes of the eyes that is consistently present when both eyes are open and attempting to look at an object. Types of heterotropia. Heterotropia has two types. 1. Concomitant, or non-paralytic squint. 2. Non-comitant, or paralytic squint. Concomitant or non-paralytic squint. It is the dissociation of the eyes, wherein the angle of deviation remains the same in all directions of gaze, irrespective of the eyes of fixation. Types of concomitant squint. Concomitant squint has two types. 1. Monocular squint. 2. Alternating squint. Monocular squint. One eye is the fixating eye, while the other eye is constantly deviated. About 85% squints are monocular. Monocular squint has three types. 1. Convergent concomitant squint. 2. Divergent concomitant squint. 3. Vertical concomitant squint. Convergent concomitant squint. One eye always deviated inward, and it typically develops in early childhood before the binocular reflexes are firmly established. Amblyopia is a frequent association. Causes of convergent concomitant squint: hypermetropia, congenital myopia, uncompensated aesophoria, anatomical factors, for example, orbital asymmetry, enophthalmos, etc. Divergent concomitant squint. One eye always deviates outward. It is characteristically seen in older children and adults. Causes of divergent concomitant squint: inherent neuromuscular incoordination, uncorrected myopia, complete loss of vision in one eye, consecutive divergent squint, craniofacial anomalies, decompensated exophoria, vertical concomitant squint. One eye deviates upward. The condition can cause depth perception issues and blurred vision. Cause of vertical concomitant squint: it is rare. Most of the cases are those of hyperphoria, which becomes manifest. Alternating squint. Either eye can deviate at different times. The patient can alternate fixation between the eyes, either spontaneously or voluntarily. It may be convergent or divergent. Pay attention to the images below. Number 1. Left eye convergent, right eye fixing. Number 2. The left eye is taking fixation, and the right eye is converging under cover. Number 3. On uncover, right eye convergent, left eye fixing. When the cover is removed. In an alternate squint, the visual acuity remains normal, or near normal, in each eye. There is no diplopia, as the image formed in the deviating eye is completely suppressed by the brain. Causes of alternating squint. Alternating squint may be due to congenital weakness of the lateral or medial rectus in either eye, or to refractive errors. Non-comitant, or paralytic squint. It is the misalignment of the visual axes as a result of paralysis of one or more extraocular muscles. It is characterized by impaired movement in the field of action of the muscles. Thus, the angle of deviation varies in different directions of gaze and with the fixation of the eyes. Etiology of non-comitant squint. Lesions affecting the cranial nerve supplying the muscle, for example, nuclear lesions, lesions of the nerve, lesions in the muscle, for example, congenital maldevelopment of a muscle, direct injury to the muscle, diseases of the muscles. Clinical features of non-comitant squint. Diplopia, false orientation of the object, vertigo and nausea. The secondary angle of deviation is more than the primary deviation. Restriction of ocular movements in the direction of action of the paralyzed muscle. Compensatory head posture. Visual acuity is normal in both eyes.